afternoon, Doctor. This is Janet. I'm Susan's twin sister. I know about patient-doctor confidentiality, but I really need to know how she's doing. Because of my work and my children, and quite frankly, we've had financial difficulties lately, so I can't get over there easily. Bottom line, I don't think Susan is telling me everything. I just want to know if she's going to be well soon, or if she needs me there. I know she has a lot of friends around her, but I'm her sister.
And 40 years ago, nobody talked about cancer. I remember the first day I started working in the hospital in Glasgow, and the surgical ward in Glasgow was, you come up and there was, to the left was the women, to the right were the men, and they were completely separated, and there was about 60 beds, 30 on each side, and halfway down the ward was a curtain. So I was walking around and asked the sister, what's the curtain for? She said, it's the cancer patients behind the curtain. So people didn't talk about cancer. Now people talk about cancer.
Is cancer still considered a death sentence by the people in Peru?
Well, the people in Peru, we have to, educate them. But cancer definitely is not a death sentence.
You know that, but do the people of Peru know that yet?
We are working on that. That is why we have instituted Peru Against Cancer Week, and we do a lot of education. We have radio programs. We go out on newspapers. So we're trying very hard to tell our people that cancer can be cured and can be prevented, of course.
A few years ago, women were paralyzed by the concept of having breast cancer, and that led to situations in which women would not seek attention just because they were scared. They were scared of the whole concept. We detect now a much more proactive role. The message is out that you can cure breast cancer, that you can cure it if you take a proactive role, if you diagnose early.
When the National Cancer Centre first opened, the taxis wouldn't come up and wait in our taxi queue because it was a cancer centre. That's soon stopped. I mean, we now have plenty of taxis, but it surprised me. And it's something that we also have to address. So if you look around the cancer centre, we have a pink building. And red is a colour which is happy, which is auspicious. And that sort of cancels out the inauspicious, unlucky thing about cancer. So you see our nurses' uniforms are pink or peach colour. The furniture is pink. And so we have a lot of these sort of colours to neutralise, I think, what you would say the stigma of cancer.
I believe that you have to educate individuals about what cancer is, and that doesn't happen the day they're given the diagnosis. I think it has to happen before.
We have had research among the people, and we observe this strong perception of population between cancer and death or other suffering situations. The people don't have a perception of cancer is curable.
It's not a death sentence for most people now, unlike in the past, but still a lot of people are terribly devastated when they are told that they have a cancer, or as I just saw half an hour ago, when the cancer comes back in my patient, they're devastated. This particular patient just burst into tears, see. But having said that, there's a more enlightened approach to handling cancer now amongst the lay community. They realize that there's good help on hand.
There is a huge fear. People are very afraid of dying with cancer. They're not afraid so much of dying with a heart attack, and that's because, it's sudden. But cancer is a long, drawn-out process, and the end stages are not very pleasant, and so there is a great fear about it.
I want things to happen faster. I do believe that if we've learned something from the AIDS advocates and to apply to the cancer situation, it is, come on, let's get a move on. You know, there are a lot of people dying of cancer, and what are we doing sitting in endless meetings and endless planning groups and appointing ever more administrators to hold charts to find out how well we're doing. You know, let's roll up our sleeves and adapt some of the urgency of the challenge. This is a global challenge, cancer. I mean, the WHO have now come out with a statement which has shocked even them, I think. They're saying that the more people die in the world from cancer than from malaria, from AIDS and tuberculosis put together. So this is a global issue, and there's an urgency about it, particularly in the emerging countries of the world where the tobacco companies have moved, as they've been frustrated in America and in Western Europe, and their profits are beginning to get down a bit, and their shareholders are a little bit agitated. You know, the tobacco companies have had less attention lately because the banks have been the source of concern. But you know, the tobacco companies are still out there, and they're still making profit, and they're moving into emerging countries, and they're flogging their wares, and they are creating more and more people with cancer to fill the gaps which in the Western area have now been sealed off.
While I've told you that we could dream of a day without cervical cancer, I am personally not optimistic that that day is going to come in our lifetimes. Unfortunately, the politicians and governments are just not going to allow that to happen, which is oh so unfortunate.
Well, I just say, let me operate, please, and quietly. That's an answer for the politician and the administration. I just want to do my job and to cure cancer if it's possible. I don't care with the administrative paper, or that's not my job.
There's inevitably a roadblock called bureaucracy. No question about that, and whether it's a local ethical committee or a religious group complaining about a stem cell approach, or whether it's a government trying to save money using spurious science to bolster their cost-efficacy arguments. Yes, those things are bureaucratic frustrations.
Cancer is our leading cause of death in Thailand, so we must use a lot of resources to fight against this kind of deadly disease, but we still have the limited resources, not only the financial but the human resource. So our next challenging problem is how to build our capacity building to fight against this cancer. So not only our own resources, we need some cooperation with the international level. So cancer is not our problem anymore, it's the global problem.
We went to the women's jail to find out the cervical cancer problem there, and I found out something very interesting. The Social Security, two private groups, the Ministry of Health, were visiting the women in jail and doing pap smears. So they had 3, 4, or 5 pap smears in a year, instead of opening the gate and going to more people and widening the coverage.
We at Cancer also have an ethical dilemma in the sense that we're spreading awareness. We're trying to get people to go for early detection or to check their bodies, but are we actually raising expectations? Because how are they going to get the treatment?
A few things we've learned. First of all, I think one of the most important things, and it's often forgotten, is to get the physicians to stop smoking themselves. It's a very, very important point, and I think in the United States was one of the harbingers of where the U.S. was going when our physicians began stopping in the late 1950s and 1960s. The early 1950s in the U.S., physicians smoked more than the general population. It was an upper middle class thing to do. When word began getting out about the fact that lung cancer is caused by tobacco use, so is heart disease, and so on. And the 1964 Surgeon General's report came out, which was the watershed event in this country. Physician rates went from around 50% in the early 50s down to around 2% today. China, nearly 50% of physicians smoke. India, the data are not as clear. But that's one area.